Welcome to this year's annual Cultural and Diversity Training. This is the CGMM Skilled Nursing Training video. The training video will cover the following topics: understanding cultural diversity, awareness of biases, unintentional and intentional, enhancing our sensitivity to cultural differences and similarities, verbal and nonverbal communication methods, strategies for fostering a cohesive working place, and finally, identification of appropriate versus inappropriate behavior in the workplace. Let's begin with understanding our cultural diversity.
So, federal law requires Medicare and Medicaid certified nursing homes to have a registered nurse on duty at least 8 hours a day, 7 days a week, and a licensed nurse RN or LPN on duty 24 hours a day. However, there are no minimum staffing levels for nurses' aides in a skilled nursing facility who provide most of the day-to-day care. Instead, nursing facility are required to provide sufficient staff services to attain or maintain the highest possible level of physical, mental, and psychological well-being of each resident. In addition, skilled nursing facilities must provide a minimum of 75 hours of training for the aides. An important factor in improving quality of care is the amount of nursing time each patient receives. If a nursing facility met only the federal nurse staffing requirements described above, a resident would receive 20 minutes of nurse time per day. And as for the members of the Seventh-day Adventist Church, have promoted variations of Seventh-day Adventist diet since the church's inception in 1863. They do believe that their bodies are holy temples and should be fed the healthiest food. Their diet pattern is based on the biblical book of Leviticus, which emphasizes the whole plants of foods such as fruits, vegetables, grains, nuts, legumes, and discourages consumption of animal products as much as possible. Some are excluding animal products from their diets, also discourages the use of alcohol, tobacco, and avoiding sweeteners and caffeines. Thank you.
On this slide, we want to discuss the best practices that we can utilize to better service our Jehovah's Witness patients and their families. This slide shows how we can keep the patient fully informed on diagnosis and prognosis. We can keep parents informed of healthcare decisions of the minor, and we can provide medical assistance, comfort, and spiritual care. The patient should be fully informed on diagnosis, prognosis, and treatment recommendations so that informed healthcare decisions can be made. Parents have a legal right to make such decisions for their unemancipated children. In rare emergent situations where doctors believe it is necessary to obtain a court order to impose a transfusion, for instance, the parent should be informed of such intended action as early as possible so that they may also be represented in court. From learning about Jehovah's Witnesses, we know that they do not observe special rituals that are to be performed for the sick or for those dying. Every reasonable effort should be made to provide medical assistance, comfort, and spiritual care needed by the patient. Some of the internal resources that will be made available to you is to rely on the hospital liaison committee and the local congregation of elders. In all congregations of Jehovah's Witnesses, local congregation elders, which is a body of elders, they are there to help function and provide needed spiritual and emotional support to members and their families on a weekly basis while the member is a patient. These elders are very familiar with the convictions of witness patient and can better communicate with them. This can help eliminate misunderstandings and can facilitate medical treatment by physicians. We also want to look into the hospital liaison committee, which is composed of trained and experienced professionals who act as a liaison between the doctor and the witness patient. At the patient's request, their services will be made available and can assist with solving problems that may arise when physicians believe blood is necessary. They support the family and the attending physician by locating doctors and medical teams experienced in non-blood management techniques. Surprisingly, there are more than 12,000 physicians in the United States who are cooperating in utilizing such alternative medical strategies. Hospital Liaison Committee members have extensive information on available alternatives to blood transfusion therapy. They maintain up-to-date information on non-blood management strategies and can assist in transferring the patient if necessary. The Hospital Liaison Committee of Jehovah's Witnesses have a folder that it distributes. Included in this folder is a document entitled Hospital Protocol for Treating Jehovah's Witnesses and several other articles such as the one we show here. This article has lots of documents clarifying their stand and citing examples of successes in caring for patients without using blood. If we further look through the article, we see that they provide clinical papers and information. They facilitate physician-to-physician consultations. They make presentations to physicians if necessary. They clarify ethical issues and arrange for pastoral care. I think this is a nice form that we can all utilize.
We have seen in this video multiple ways that we can provide quality health care to our Jehovah's Witness patients. It is important now to see what, if any, dietary restrictions exist that we can accommodate. After doing some research and investigation, we were able to determine that while some Jehovah's Witnesses are vegetarians, others do eat meat, which has led us to understand that they do not have any restrictions on their diet. The only real restriction is that they will not consume any food product that might contain blood or blood products. However, since our food does not contain any blood products, that should not be a problem. However, we will be offering vegetarian meals for those who prefer it, as we'll have other food alternatives.